Hi again, it's me. It's such a beautiful day, such a blessed day. I'm blessed to be alive, to be healthy, and I thank God for that. So this is another segment whereby we are going to talk about how I got infected and about ARVs and how they work. In regards to the ARVs, I'm not really going to talk much about it because I wanted in the near future I'll bring a doctor, an expert on ARVs so that we can have a discussion and he'll give or she will give a general overview about how the drugs works, the type of drugs. I believe it's good if we have an expert so that we have a wide scope of all about what it entails. Now, through my Facebook page, there have been questions about how I got HIV. Like, normally, there are people who are born with HIV, there are people who get infected through sex, there are people who get infected through blood transfusion, or maybe getting cut or something. So my scenario is quite different. I was never born with HIV. It was sexually transmitted. And this is the more reason I normally tell people it's very important to test yourself so that you also know if the other partner is infected or you're going to infect somebody else. So for me, it was just sexually transmitted. Maybe it was I will not start saying that it's somebody else's responsibility. It's my responsibility to make sure that I test before I engage anybody else. And you see, the problem with us is we get so much carried away. And you're like, this person looks healthy, she's okay. And then you get used to things, which is not right. Let's really be responsible sexually. So let's test ourselves, make sure that our partners are tested, so that we are not in a scenario whereby you will get exposed and you get so sick. By the time you know, because you didn't know that you were infected, most probably you've infected somebody else, not knowing, and it's not right because, you cost a lot, you cost someone's life. And as I said before, not everybody is strong enough. So you can imagine if you're infecting the other person, how much burden you're bringing into that person's life and misery. So I really want to encourage people to really, before you engage with anybody with sex, kindly test and test. It's very important. About the ARVs, there's so many different types of ARVs. There is a first line regimen, there's a second line and the third line, whereby if you fail the first line, you're put into the second line, which also has variety of medications. And if you fail the second line, then you're put on the third line, which you have to buy, and it's very expensive. So normally the first line, I'm just giving a short overview of it. Normally the first line is that's the first medication you introduce, the ARVs. The meaning of ARVs is antiretroviral therapy or treatment. This is whereby the moment you are tested positive and your CD4 is very low or your viral load is very, very high, this is whereby you introduced to ARVs so that they help you minimize the load in your body. And that's why you're introduced to the drug, so that they can help you lower the load and protect your immune system. So personally, I started on one called TLE, and then with time I was switched to, this is what I'm using right now. It's called TLD. And at this point, it's not necessary to use septrins, but I normally use it for my own protection in regards to, opportunistic infections. Septrin is a very, very, very strong antibiotic, so it really helps. It's not mandatory. At some point when your viral load is at 0, it's not mandatory, but again, for me, I would still want to continue with this. And with this ARVs, it's very important you take a lot of water when you're taking your ARVs, because, there's a lot of toxins in your body, and you don't want to damage your kidney or your liver. So the intake of water has to be very high. Like, just do it randomly throughout the whole day. It really helps to clean your system. Now there's the part that we call adherence. There's a problem with people, and especially people who recover, and then when they become okay, they start thinking it's a joke. Like, you find people, you're supposed to take your drugs like 9 in the morning. You find the people who just don't even put an alarm on their phone. They just don't care. The moment they wake up is when they think, oops, I should take my medication. Remember, this drug suppresses it suppresses the virus. So after 24 hours, the strength is over. So you need to take another drug. Like, for example, I take my drugs at 9 in the morning. So every 8:58, my alarm has to tell me it's time to take your drug. So I normally carry this and the Septrin if I'm leaving the house early in the morning. For me, I'm not scared to carry this because I've already come out. But for those people is that you feel like I don't want people to know that I'm taking drugs. There's some small envelopes sold at the chemist. Just put your drugs, have like 2 or 3 pieces of each. Just fold them properly, keep them in a nice place. Make sure you have some water so that when that time comes, because adherence is the only reason you'll be able to permanently suppress your virus. That is how you become healthy. That is how you move on with your daily life without having other ailments or other issues. And then there's a story of those people who take drugs and at one point you think, okay, my viral load imeshuka chini, so I'm healed. There's nothing like that. It is just the suppression, but the viral load is low. But in the real sense, the moment you stop your medication, other opportunistic infections come back, and this time they might even kill you or take you down. And that's why you see most people fail drugs, because of not adhering to medication. So I really, really want to encourage people, please take your drugs on time. Take your drugs daily. It's for you. It's for your own good, not somebody else's. And then there is that notion of, actually, I had somebody asking me, hizo dawa za ukimwi zinakunyanga mingi sana, si mingi, siku hizi ni moja. You can see it's a small drug, very small. Imagine it's all, there are people actually who don't take Septrin, so they only take this size. So it's just like a Panadol. It's actually not a big deal. There's a lot of, misconception about this drug. It's a very small drug, so, and it's not even, you don't feel like nauseous or anything. But the first few weeks, most people experience hallucinations, which is okay, because that time, the virus is in your body, and then the drugs are trying to fight the virus. So clearly your body becomes like the victim here. So at times you'll find at night you get these weird dreams and stuff. But with time, like 3 to 4 weeks, it's over and you start a normal life. But you're normally told when you're taking ARVs and you have like serious side effects, it's good you go back to your facility, notify your doctor, because we know we have different kind of bodies. People react differently. So if you really feel like something is amiss, do not just ignore. Just go back to your facility and make sure they change for you the drugs. About the Septrin, I had said it's a very strong antibiotic. It's also very small. It looks like a Panadol. So you can imagine if you're taking the 2 of these, it's like you're taking 2, when you're taking the headache, it's only 2, or Panadol, it's only 2 of them. So imagine it's not even such a big deal, and you shouldn't be ashamed of taking your medication, that you're hiding yourself, maybe you're in a matatu. Like, there are those who take their drugs. The reason I take my drug in the morning is because of the side effect of sleeping. If I take it at night and I take a lot of fatty foods, then I'll struggle with insomnia. So taking it during the day helps me a lot. There are people who take those ones that they take at night before they sleep. So it depends. So imagine if you're in a scenario whereby you're taking drugs during the day, I would really just tell you, do not feel ashamed about it. Just, you can even go somewhere, just take your water and move on with life as if nothing has happened. So I'm really, really pressing and emphasizing on kindly let's adhere to our medication. Let's adhere to avoid other issues. Let's adhere. Love, you see, like, this is your life. After God, this is your life. This is what has made you reach where you are. Without this, you would have been dead, which is the truth. So I'd really tell people, please, if you're given your medication, don't go throw them away. Don't go and keep them somewhere and say, mimi ni kusawa. No. Just take them. With time, you start realizing, oops, so they're actually helping me out. For those who know me, you can tell from the photos of before and now, even my skin is glowing, it gives you a new lease of life. So kindly, let's strictly adhere to meditation. Special thanks to AfriConnections and Professor Joseph Ndele of Minnesota, USA, are the sponsor of the YouTube channel under the book Africans and Americans. This book, if you're coming from abroad to Africa, or from Africa going to abroad, and you have no idea of the cultural differences, and you don't want to experience culture shock, you really need this book. If you're a tour guide and you have tourists, you need this book to guide you, for it to guide your tourists on how to go about cultural differences between either Europe or here in Kenya. So if you need this book, it goes for $14. The link to get the book is on the description. Also, special thanks to Sukex Drew in Bristol for the venue and support. If you need to get to them, just take the link on the description. Special thanks to Denzel, my videographer. He does an awesome job. He's a good guy. He's very easy to get along with. Also, his link is on the description. And special thanks to anyone who's been in support of me in one way or another. Thank you.